So very good evening to all the gentlemen here and the ladies. My name is Sunil Shrikafla. I'm the Country General Manager for NeoLacta Lifesciences. I know I'm standing between the session now and also the tea break. So I'd like to make it very short, crisp, and also bring in a little diversity to the set of presentations which have been happening since morning. Okay, we have seen a lot of technological side of it, how technology can play and amplify the pharmaceutical industry going forward in the world. But what as a company we are doing is going to definitely impress and also try to inspire each one of you sitting here. So this is one such platform which we wanted to highlight the kind of work and ideas what we carry forward to the society. As the heading goes, these are very small steps, but we believe these small steps can have a very big impact, right? And what we want to discuss here is how an early life nutrition, especially for the babies who are very sick, tender, young, as early as 24-week babies who are not yet seen the world, external world, how a nutrition for these babies can really impact the outcome and the life in the overall, and how it can shape a healthier society. So the background, if in case I had to give you, why as a company, why as a startup we have been in India, what exactly is the background of this is, India contributes to 1/3 of the global preterm births, and that's to the tune of 3.5 million births in each and every year. And for all dubious records, we are the preterm capital of the world. Very little we know that India carries such a kind of a burden. It also is fact because a lot of deliveries happen in India. We are the most populous country in the world. And also with the lifestyle complications, another set of challenges, the preterm deliveries are increasing. And mind you, this fact what I'm quoting you is from Lancet 2011. But we stand in 2023, so 12 years, lot of statistics would have definitely taken this forward only, not lesser than this. So, what we also have realized, the preterm birth is a major risk factor for infant mortality. And the second thing which we have also noticed is 72% of infant mortality rate happens within the first 28 days of a life. And this is quite unfortunate. And as we know, the government of India also carries one of its sustainable developmental goals is to reduce the infant mortality rate. So what happened further? We found breastfeeding is the single most effective intervention in protecting the newborn babies. And 51% of the mothers who deliver preterm babies struggle to produce breast milk. In absence of mother's own milk, globally there are standards, globally there is a technology, globally there are practices which allows pasteurized donor breast milk to be used in these babies. But India being backward, at least I can say by 2 decades compared to the Western world, it's very naive and we are in a nascent stage to adopt this concept, which is pasteurized donor human breast milk. And if I could just give you a landscape perspective, what is the need and what is the gap? What you get to see here, the various data points suggest we have only around 90 human milk banks in India against an estimated requirement of 1300, which is very conservative expectation, our estimate. And in 2019, a survey pointed out that 2/3 of these milk banks reported self-sufficiencies. They had problem in supplies, they had problem in standards and quality. 30 to 50% of the neonates who are admitted in NICU are in need of this donor human milk. If you remember the statistics from the earlier slide, 3.5 million, I'm putting 30% to 50% out of that, which is close to 1 to 1.75 million babies. They require these products in yearly in Indian basis. And currently, imagine for 1.75 million babies, we only have 90 milk banks processing less than 1% of donor human milk in India. That's a need and that's a gap as a company which we're trying to fulfill. What NeoLacta Lifesciences provides is a viable model of value-added human milk processing through patented technology, which allows a wider reach and easier access to donor human milk products in India. We also have found from where does the milk come. This is not something which we manufacture and which is just synthesized in the lab. Irony is, there are mothers, 13% of the mothers, overall mothers, have hyperlactation as one of their problems. These mothers become a contributor for us. What we do, we maintain equilibrium between the demand versus supply. We scout for these mothers, we identify these mothers and encourage them to come forward and donate and then take it, process into pharmaceutical grade facility, add value into it, then supply it back to the NICUs across India. This is a value offering which NeoLacta as a company does. Let's understand how did company evolve. This is a plant which you can see in Bangalore. And if any of you have any understanding on the human milk processing facility, I can say this is one of its kind in South Asia, right? And we maintain global standards as per the US FDA and the WHO GMP certifications. And we joined selective nations like USA, UK, and Japan. Only these countries have this kind of a facility. Now we brought this facility to India. The founders of this company have 20 plus of years experience in human milk processing. And the founders also had a record by setting up a first human milk bank in Australia. So the genesis happened back then in 2003 when they had contributed to set up a first human milk bank. While doing the research, they realized globally there is a huge demand, and coming from an Indian background, they said India has the highest incidence and this is where we should go and impact the society. The only company in South Asia, as I told you, with FDA pasteurizing standards, and NeoLacta products have transformed the landscape of newborn healthcare through its patented, all our processes are patented processes. So this is only our company can process as of now in India. Sorry. Okay. What has been the impact till date? It's been 6+ years for us as a company. We had very small steps to initially start with because of the concept being new, and there is a resistance coming in from various sectors, including the doctors themselves. How do they believe whether it is a mother's milk or something else which you're feeding? So we had to break all those notions. Now we stand at the critical juncture where we are able to think and also create clinical studies to support the fact that yes, these are the products which will have an impact in your NICU setup. And as you can see, we have a pan-India presence. We are a standard of care in many NICUs. To number, it will be 450 plus NICUs in India. They use our products as a standard of care in absence of mother's milk. Then we also, with the introduction of NeoLacta products, there is a very less reliance on cold chain maintenance because the frozen milk goes at -20 degrees across India. So what we have done with technology, we try to convert that into powder form so that the mother milk is available in the remotest part of the India with the sachets and the powder. They can just reconstitute and use it whenever the baby requires. And we also have a CSR. It's a very generous CSR what we do, where more than 1,000 plus babies are benefited. We also have earmarked 5% of our milk which we process towards the CSR. Anytime there is a request which comes across saying the baby cannot afford, the parents cannot afford this kind of a price or whatever it is, the CSR helps them. We believe our products have impacted more than 80,000 plus babies till date, over 6+ years, around 450 plus hospitals. But if you remember a few slides back, I told you the requirement is 1.75 million babies. So we are a very long gap, and this is the cumulative number of 5 years. So we not even scratch the surface of it. That's the immense potential what this product and this category holds. Whenever we participate in these platforms or any other platform, is to seek awareness and is to create awareness and seek advice and guidance. How can we propagate this concept to the much bigger society? And how can we make this concept profound so that every mother knows that there is an option like this. If in case I'm unable to breastfeed, there is an option like this. At the same time, if a mother is lucky enough, she can come forward and also donate to our program. What we look at as a company, it's not that everything is rosy for a company. No, it's not like that. We have a vision of impacting more than 1 million babies by 2030. We also are propagating a concept which is called exclusive human milk diet. Okay, how a baby should be only fed mother's milk or donor human milk for first 6 months so that there is a long-term benefit of a baby, and that's what WHO also recommends. What we also see as an ecosystem, from the time NeoLacta has come into India, the number of milk banks also has increased by 4x. That's been a contribution because there's a greater awareness, greater adaptability to the concept. And more hospitals also realize that yes, we need to have our own milk bank so that we increase the accessibility of these products to babies. What also as a challenge, what are other challenges as a company we face is the operational framework. This being a very new concept and we being the only player, we do also face a lot of operational challenges. It could be in terms of policy side, licensing side, and many things. Because it doesn't fall into food, it doesn't fall into Ayurveda, it doesn't fall into drug. Each person has their own perspective. Unlike in global economy, if you see, US clearly categorizes this as a food. UK, this classifies as a food for special medical purpose. In Japan, this gets classified as a drug. In India, we feel it will be a evolution. It will take another few years for us to form ourselves. What do we come out as? But this also makes way for innovation going forward in the same category. For all we know, mother milk has got a lot of properties, which as a company we have a capability, we have done a lot of research. If the regulatory framework sets, we are all set to launch at least 4 to 5 new offerings based on mother milk products only. And the social stigma. Can I use? I don't know from which mother has it come. Has it been screened? Has it been qualified properly? How has been the quality parameters and all those things? Then obviously about the right side, which is on human rights. Whether it is good to collect milk from some other mother and give it to some other mother. So as a society, this is something which we are facing, and I'm sure this will evolve in the coming years. At the end, what we look forward to is improved access to donor human milk-based products across India for the preterm babies. So this is us, and we also are proud to announce that we have India's first breastfeeding helpline. If any mother, any new mother requires any support, we have a team of dedicated 40 lactation consultants who can provide support to these mothers and help them breastfeed better themselves. And please do follow us on our social media handles so that keep sharing your feedback, advices, and propagate this concept to your known circles. That's it from my side. Thank you very much, IELTS, for providing this platform.